Welcome back to your own YouTube channel Ask Your Gynecologist. I am Dr. Sonal Parihar and today I am back with the video of what you should not eat during pregnancy. It is in continuation with my previous video. In the previous video we discussed what all things we should be eating, and today we will discuss what all things we should avoid which are not good during pregnancy. Right? Now, as I discussed earlier, pregnancy is not a disease. It is a physiological phenomenon in which a baby is growing inside you, and for the 9 months that the baby is inside you, you have to take care of your calorie intake. Whatever you eat, the routine food, it just needs to be modified. Which has to be taken more, which has to be taken less, and which should be absolutely avoided. Right? So first of all, avoid spicy food. Asian population, especially we Indians, we are very fond of spices, garam masala, red chili, green chili, lots of oil, lots of ghee. Please avoid that, because whatever you eat, it is going to affect your GI system. You're going to develop lots of ulcers in your food pipes, lots of gastric problems as the baby grows. As your tummy grows, you'll have more gastritis, and whatever you eat gets transferred to your baby. Right? So even the baby will end up with having gastric problems. And many times patients do complain of irritation while passing urine. Dysuria, that is painful urination, that is because of the food, the spicy food that you are taking, and that gets excreted in your stools and in your urine. Right? So avoid spicy food. Secondly, you should avoid taking unpasteurized milk and unpasteurized juices. Now, as we know, sterilization and pasteurization, these are very important to kill the bacteria and the viruses which exist in these particular beverages. Like it can be milk, it can be juice. So if you boil it properly and take pasteurized milk from the market, then you will protect yourself from the unhealthy bacteria and the viruses, like in the form of salmonella, which causes typhoid, even toxoplasmosis. All these bacteria, they are there in the animals, and these get transferred to you if you do not take care of yourself. Right? Next, coming to the vegetables and the fruits that we eat. Please wash the vegetables and fruits that you are taking properly. You can use some vegetable wash soaps which are available in the market, so that you can get the entire fruit and the vegetable clear of the bacteria and the viruses that exist on the surface. Generally, whatever vegetables you are taking, if you peel them off, then you will obviously get rid of all the bacteria, the surface bacteria and the viruses. But if you are still eating them with the peel or cooking them with the peel, cook them properly and wash them properly. Avoid sprouted pulses, sprouted rajma, sprouted beans, sprouted legumes, because we are very fond of eating all that, especially the people who are very conscious about their health. Do not diet during pregnancy and avoid these sprouted legumes, because they are a good source of bacteria and that might affect your GI system. The kind of bacteria that you might encounter because of these may be E. coli, which exists in your intestines, then toxoplasmosis, then even salmonella, which causes typhoid, then listeria. All these bacteria are very, very unhealthy, and they might affect your baby as well. Coming to the hot beverages, generally we all love having coffee or tea, or maybe Coca-Cola, or maybe cocoa powder in our milk. So now these are very good sources of caffeine, and caffeine is not good for you. So if you are really addicted, do not take more than 2 to 3 cups of coffee or tea in a day, and I would advise just stick to half a cup of tea in the morning or half a cup of tea in the evening. That too, if you can make it lesser, come down, then it will be better. Because the more caffeine you take, it gets secreted in the placenta, it passes to your baby, and the baby cannot digest this caffeine, and it ends up having growth problems in the baby. Baby may even be growth retarded, or you can have a preterm labor as well. Talking about salmonella, which we discussed just a few minutes back, salmonella typhi is a bacteria which causes typhoid. Now, the patient, the mother who has ingested and is suffering from typhoid, will have diarrhea, vomiting, maybe low-grade fever with chills, crampy pain. Sometimes this crampy pain might affect the uterus and may expel the baby before the expected date. That means you might end up in preterm labor, and there will be many growth problems as well. So please be careful of whatever you are eating. Right? Coming to people who are very fond of junk food. Junk food is very rich in sugar, very rich in calories, especially pastries and cakes and confectionaries and cookies and burgers and patties. They're very rich in calories, but they're all empty calories, because they do not have the nutrients which are required for the mother and the baby. So they end up giving you lots of fat, So the mother will get fat, it will with no useful result to the baby, and because of the fat you will end up developing diabetes mellitus, gestational diabetes, or even pregnancy induced hypertension, which might later on continue even when you have completed your pregnancy, right? So please avoid junk food. Coming to the non-vegetarians. Now with the non-vegetarians, again the same problem. Please do not take undercooked meat. Undercooked meat can be chicken, it can be mutton, it can be fish. All these animals are hosts for bacteria. So if you do not cook them properly, all those bacteria which exist in these animals will come to you. Now toxoplasmosis, which I have mentioned many times, it is a very lethal viral infection which can cause multiple abortions, it can cause facial deformities in your baby, it can cause blindness in your baby, it can even lead to CNS problems, mental retardation, lots of other problems in the baby. So you have to avoid all this by cooking your meat properly and even your vegetables properly, right? Coming to the people who are fond of fish, as I said, please do not ingest undercooked fish. But even for people who are consuming lots of fish which is properly cooked, lots of fish again is very rich in mercury. So mercury levels, if they rise in your body, they are very toxic to kidney, to liver, to your brain, to your immune system, and obviously if this gets secreted in the placenta and goes to your fetus, then just imagine what will happen to the baby. So please be careful. As I said in the previous video, fish is good as it is a good source of cod liver oil, but please avoid eating too much fish because it is rich in mercury. Okay. Then coming to eggs. Now eggs can be consumed by non-vegetarians or vegetarians. Whenever you consume egg is a very good source of protein as we discussed last time, but please cook it properly. Do not go for half fry or half boiled eggs because they are very rich source of Salmonella typhi, which I just mentioned can cause typhoid and can be lethal for you as well as for the baby, right? Lastly, I will discuss the two main things which we normally avoid in even the non-pregnant ladies or even the men, right? A normal human being is generally advised to stay away from these two things, and that is alcohol and second is smoking. Even the tobacco chewers. Tobacco chewing is very common in our country, especially the part of India that I'm standing in, Rajasthan. Tobacco chewers are like I've seen even little kids chewing tobacco. So please avoid this when you're pregnant because it is going to have lethal effects on your baby, growth retardations, then lots of facial deformities, especially the alcohol syndrome which is more common in the European countries because they're very much addicted to alcohol as compared to the Asian ladies. Alcohol syndrome will lead to a very deformed face of the baby, very thin growth retarded baby, and lots of problems in the mother as well. So please avoid alcohol, please avoid nicotine in the form of smoking and in the form of tobacco chewing. So I think that is all for today. I don't think there is any other thing that you need to avoid. All the fruits are very good, so do not be under the myths that we cannot eat papaya and all that. We have already discussed that in the last video. And do subscribe to my channel, Ask Your Gynecologist. I'm saying this because I get so many questions every day. I'm answering almost 25 to 30 questions every day on the YouTube in my inbox. Many people do ask me, ma'am, please explain this, please explain that. So I tell them, go back, I have already uploaded this video, I have already discussed this. Then they come back to me, ma'am, I can't find that video. That's because you have not subscribed. Unless you subscribe, you will not get that list of 40-50 videos that are already there in my channel. So please subscribe. You can even click on the bell so that you get a notification as soon as a new video comes in, right? All my videos get uploaded on Sundays and Wednesdays. So please make a note of that. Like my videos, view them properly, listen to them carefully, and do share it with your friends. You can also follow me on my Instagram handle sonal.parihar.33. So till then, take care. I will be back again with a new video. Bye bye and take care.